Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
You're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic education for real clinical situations. We've got you covered.
And today we'll be talking about pelvic floor muscle contraction or Kegels and how to prescribe these exercises to your patients.
So when we're doing our bimanual exam, and think about anteriorly, the front, you should feel a squeeze at the introitus. And you should also feel a lift from deeper inside of the pelvic floor. If you're having urinary incontinence, then maybe those periurethral muscles aren't as supportive as they should be. Do you feel the clitoris, the urethra squeeze around your finger? And then as you're asking the patient to contract towards the front, the anterior part of the pelvis, what are you feeling in the back, around towards the tailbone, back towards the rectum? Is that overcompensating? You want to insert your entire second digit and direct the pointer finger directly down to the coccyx. And then ask your patient to contract. You feel the lift, or what we call flex of that tailbone into your finger.
And then a good patient education plan is your patient is lying on their back in a hook lying position with their feet flat on the table and knees bent. And you have them take a nice deep breath. On the exhale is when they're going to contract. So they're going to squeeze the vaginal opening or squeeze around your finger. And then they're going to try to lift too. So the pelvic floor muscles are lifting up to the belly button. They're holding that for 5 seconds. Again, you're feeling where they're engaging the most. If they're not able to engage the pelvic floor muscles at all, then have them use a toilet paper roll or a yoga block and place that right at their inner thighs up by the pubic bone. They'll gently squeeze that every single time that they contract the pelvic floor muscles on the exhale, and that will carry over into the pelvic floor and help it activate. Start with having your patient do 3 sets of 10 Kegels per day. The morning is often better because their pelvic floor has had the time to rest overnight, but have them do it whenever they can. No need to do, 50 to 100 of these daily. It's really the quality of the contraction that's important, not the quantity. You can also educate them on quick flicks if they're having stress urinary incontinence or incontinence with sneezing or coughing. The quick flicks are a quick contraction and release or pulsations of the pelvic floor muscles. And those you can do sitting or standing, but ideally you want to have them lying down to take gravity out of the picture. All right, and that's a wrap. Did you like this video? If so, hit like and subscribe, and please share with your colleagues.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. You'll also get access to our free weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce that we're developing an online course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with all kinds of pelvic floor dysfunction. By simplifying the pelvic floor, will improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize the field of pelvic floor health. See you soon.